Hello, everyone. My name is Elijah Lujan, and today I'll be going over kinesiology concepts that have been studying over this past semester for the midterm exam. This presentation is also designed as a study guide for the exam, and I'll cover the basic terminology of planes and axes, skeletal, articular systems, spine, joint movements, range of motion, open and closed chain exercises, the muscular system, and then focus on shoulder, elbow, wrist, and hand. By the end, they should have a solid review of the main points that will be needed for the exam. So, let's get started. Basic terminology, planes and axes. When we talk about human movement, it's important to understand planes and axes. The sagittal plane divides the body into left and right. Movements here are flexion and extension, like squats or bicep curls. The frontal plane divides the body into front and back. Movements here are abduction and adduction. Like jumping jacks or side raises, the transverse plane divides the body into top and bottom. Movements here are rotational, like turning your trunk or throwing a ball. Overview of joint movements. The most common ones in this are flexion and extension, which are bending and straightening. Then we have abduction and adduction, which mean moving away from or toward the midline. Rotation can be internal or external, depending on which direction the limb turns. There's also circumduction, which combines movements in a circular motion, like arm circles. Some special terms include pronation and supination for the forearm and inversion and eversion for the ankle. These terms come a lot in both exercises and injury prevention. The skeletal system has two main parts. The exoskeleton has 80 bones, including the skull, vertebral column, ribs, and sternum. The appendicular skeleton has 126 bones, including the arms, legs, pelvis, and shoulder girdle. The skeleton does 5 big jobs. It supports the body, protects important organs, creates movement with muscles, produces blood cells in the bone marrow, and stores minerals like calcium and phosphorus. So, it's not just structure, it's a living system that keeps us moving and alive. Articular joint system is where the joints are where bones meet, and they are classified into 3 main types. Fibrous joints are immovable, like the sutures in the skull. Cartilaginous joints are slightly movable, like the pubic symphysis or the discs in the spine. Synovial joints are freely movable and are the most common in the body, like the shoulder and, of course, the knee. Synovial joints have special structures that make movement possible. These include the joint capsule, which surrounds and stabilizes the joint, synovial fluid that lubricates and reduces friction, and articular cartilage that cushions the ends of bones. These parts all work together to keep joints moving smoothly and thoroughly. Spine, cervical, thoracic, and lumbar. The spine is divided into 3 main regions. The cervical spine has 7 vertebrae and is the most mobile, allowing lots of rotation and flexion. The thoracic spine has 12 vertebrae, which connects with the ribs and is more stable with less mobility. The lumbar spine has 5 vertebrae, which are the biggest and strongest, built for supporting body weight and allowing flexion and extension. Overall, the spine protects the spinal cord and helps us stand upright and allows movement in different directions as we go. Joint movement and range of motion. Now, let's go ahead and talk about the range of motion, or in 3 letters abbreviation, ROM. Each joint in the body has a normal range that we can measure. The shoulder can flex up to about 180 degrees and extend about 60 degrees. The elbow flexes to about 145 degrees and extends back to 0. The hip flexes around 130 degrees and extends to about 30 degrees. The knee flexes to about 140 degrees and extends to nearly 0. The rest flexes between 70 and 90 degrees and extends about 65 to 85 degrees. Knowing these numbers can help us track progress, spot limitations, and prevent future injuries. Open versus closed kinetic chain. Exercises can be classified as open or closed kinetic chain. Open chain exercises mean the limb is free to move like a leg extension or bicep curl. Closed chain exercises mean the limb is fixed like squats, push-ups, or pull-ups. Closed chain exercises usually build better joint stability and recruit more muscles, while open chain exercises are great for isolating specific muscles. Both are important depending on the training goal that the person is going for. Shoulder anatomy, stability, and rotation. The shoulder has three main bones: the humerus, scapula, and clavicle. It also has four joints: the glenohumeral, acromioclavicular, sternoclavicular, and scapulothoracic. The shoulder can perform flexion, extension, abduction, and adduction, internal and external rotation, and circumduction. The main muscles are the deltoid, the rotator cuff group, the pec major, and the latissimus dorsi. Some good straightening exercises for the shoulder include overhead presses, lateral raises, rows, and external rotations with the band. And the shoulder is, of course, one of the most mobile joints of the body, but that also makes it more prone to injuries. The muscular system. In movement, muscles have four roles. The agonist is the prime mover, the main muscle doing the work. The antagonist is the muscle that opposes the movement. A synergist assists the agonist, and a stabilizer keeps the joint steady. For example, in a push-up, the pec major is the agonist. The lats act as antagonists. The triceps are synergists, and the core muscles stabilize. Knowing these roles help us understand not only exercise, but also injury prevention. The elbow, wrist, and hand. The elbow mainly works as a hinge joint with flexion and extension. The radial ulnar joint allows pronation and supination. The wrist can flex, extend, and move side to side, while the hand has more complex motions like grip and thumb opposition. Key muscles include the biceps brachii for flexion and supination, the triceps brachii for extension, the forearm flexors and extensors for wrist control, and the small intrinsic muscles of the hand for grip and fine motor skills. Exercises for these areas include bicep curls, tricep dips, wrist curls, and grip trainers. These movements are essential because we use our arms and hands constantly in both sports and everyday life. In conclusion, here are the most important things to focus on. To know your planes and axes of movement, memorize the normal ranges of motion or for the big joints, understand the roles of agonists, antagonists, synergists, and stabilizers, be able to match joint types with examples, understand when to use open versus closed chain exercises, and lastly, to pay special attention to the shoulder and elbow because they show up often in both training and exam questions as well. So when studying, try moving your body through the planes and axes and quiz yourself as you do that. That way, the material sticks efficiently and better throughout. Thank you for the time for listening, and hopefully this helps with the exam, and good luck to all that is seeing this that is going to take it. Thank you.